Hey team, how are we? So I'm just wanting to do this video. I was kind of in two minds whether to do it or not, and then I thought, no, be true to yourself and true to what you stand for and true to what you do. As you know, I pride myself massively on what I do, the results, etc. I wish I could share this story with you exactly as it was, but I have confidentiality policies in place. Everything that the client tells me is confidential. If they choose to discuss it at a later date, then that's absolutely fine. But as far as them telling me anything, it stays here. I have been slacking in the awareness that I do on the medics and aesthetics, non-medics and aesthetics, safety and aesthetics, product awareness. I have a really hectic life. So I will get back onto it, and I know a lot of you did appreciate me doing that. It is quite prolific just now on social media, which is completely understandable because there are plenty of us out there that do an amazing job in the safest way to the highest standards. But unfortunately, it is even more prolific than the last time I done an awareness post, that there are people out there practicing who shouldn't be. In this instance, I want to talk to you about dissolving of dermal filler. Now, for a start off, it's unethical to dissolve someone else's work. So where does that leave the client? If they have an issue that needs dissolved, they should ethically come back to yourself and you should be happy to dissolve it. There shouldn't be any elective dissolving. We don't offer elective dissolving in here. The product that you use to dissolve dermal filler is something called hyaluronidase. When you administer that, risks of an allergic reaction spike. Now, we're not just talking an instantaneous reaction, we're talking about, you can be looking at delayed reactions. You can be talking about 12 hours down the line, 24 hours down the line, things like that. If you're not willing to put the time in out with your working hours for your client, if you use hyaluronidase, don't be administering it. Because anyone who is worth their weight will tell you that if you administer hyaluronidase, you need to be basically on call, because a good practitioner, likes of myself, and again I say myself because I can only speak for myself before anyone decides to start coming at me for that. Someone likes of myself would tell the client, listen, any issues, you get in touch with me. I'm aware of what we've done today. I'm aware of the heightened risk. Here's what to do if you have this and this. I want you to get straight to hospital. To the medics, just putting that out there for everyone that's non-medic, get straight to the hospital. And then, because I also have the NHS background, I will get to the hospital and I will meet you there. And I will have the serial numbers, the batch numbers, what we use, the amounts, what's going on, where we injected, because that's just what someone who has complete client care does. This is not a one-stop shop that you come in, it's like out the door, meet train, next. It blows my mind that people are like this, right? Every single one of my clients, no matter what I've got on that day, get 1 hour of my time allotted to them. Now, their treatment may take 10 minutes, their treatment may take the full hour, it could be anything. But see, even if it is 10 minutes, you still have that extra time there. If you want to blather, or you've got questions or whatever, or see if you just want to go, fair play, we finished early. The reason that I'm talking about this is because it's becoming, again, that word that I love, more and more prolific, that people are finding it acceptable to administer a product to a client under the guise of it being another product. As a client, you'd be none the wiser. You're taking your provider at face value. You're trusting them only by going to someone else who listens to what's been on, does a physical examination. It's only then that you may be able to find out that the product that you thought you had has not been in your face. It has become routine in a lot of places that people are administering a fat dissolver instead of hyaluronidase. Now, for one, that's a trading standards issue right there. It's not very nice me putting it out there, but I'm sorry, I'm sick of our industry being tarnished in a way that we aren't going to be able to come back from this. And it's through people that are carrying out practices like this. So again, I'm very, very guarded about what I put out on here, because as you see, there's certain ones that jump onto what I say and they pick out the buzzwords and, you know, well, we'll use that. And literally within 24 hours, you can hear them saying the exact same thing. And that is getting me down as well. Listen, don't come to my page for training. Go and get properly trained. I'm not speaking about all the training academies, of course, definitely not. The people who I'm speaking about will know exactly who I'm speaking about. But what I am absolutely disgusted at is the lack of client care and compassion when you think it is okay as a practitioner to be administering a product that is not what you're telling the client. Do you know how dangerous that is? I mean, that's the fundamental knowledge that you need to have, is how dangerous it is to put another product into a client without them knowing. Have you checked to see if they're allergic to any of the components in the mix? Have you? Because I doubt it. Do you know, I'd go as far as to say I actually doubt that the majority would know what goes into, for example, a vial of fat dissolving, be it whichever brand, or how hyaluronidase is made up and stuff like that. Because it is rare, and the only reason I know that is because I'm a secret geek. I literally get in about everything, so as I have got the best knowledge that I can put out to you guys. Now, from the learning that I have done throughout the years, by the way, 10 years in April, look out for those promos. Did you like that? That was a shameless pun there. Shameless. When I'm working on a client who has been dissolved, I am very, very aware if the correct areas have been dissolved or if they have not been. I'm very aware of the tissue pattern, and I'm very aware of when I'm injecting the different feelings of a dissolved area, a damaged area, and a filled area. So isn't it strange that I can look at someone, and I wouldn't ask my client to verify it because it's unprofessional. I'm able to look at a client, see, because I'm like long term in my area, and go, was that so and so that done your lips? Yeah, how did you know? Because I know. The same as how other places can look at, for example, lips. We're just talking about them just now, and go, is that revamp lips? Because there's always something very specific about what we do. We all have our own little twists on things. I seen that today. I looked at a client and went, do you mind if I ask you, was that so and so? I said, I know. You keep records, or should be keeping records of, entry points, volumes, what you've done where, what product's been used, all sorts of things. But when you're working on a client who's been dissolved somewhere else, you start to notice things that strike as red flags. One of these things is what we encountered today, where, you listen to the client and you're like, right, okay, so you've had hyaluronidase, but obviously, as I say, your client has put faith in the other practitioner as to what they are going to be receiving in their body, okay? However, when I go in to the tissues to work on them, that's when I see a lot of things and I feel a lot of things. It's becoming routine that people are using a fat dissolver to dissolve hyaluronic acid dermal fillers. Let's look at the names here. Fat dissolver. Ronseal does what it says on the tin. It dissolves fat, okay? Hyaluronidase, its use for dissolving dermal filler. Fat dermal filler. two totally different components here, made up in completely different ways. At what point did it become the norm that we just choose to use a fat dissolver to try and dissolve dermal filler? Because I'm going to tell you what happens, guys, and I've seen it today. If you decide to do that to a client, now bearing in mind what I said, trading standards issue right there, if you're telling someone that you are administering hyaluronidase and you administer anything else. If you administer a fat dissolver to an area where there is dermal filler issues, migration, whatever, it's not targeting the dermal filler. It is going to be targeting fat and other tissues. It is going to be targeting things like collagen, because your fat obviously creates a bolster in the tissues. Now, as I say, I could go into this very, very in depth, but there's a couple of reasons I don't, and that is because of what I was saying, and also the fact, hey, it's a selling point for my company that I know my stuff inside out. So I'm keeping it that way. When you go into a client like the client that I had today, I genuinely said to that client, I am so sorry that you've had to experience this. Not from me, from somewhere else. So I'm apologising on behalf of someone else, leaving someone in a state that was affecting their mental welfare, their mental health. They didn't want people looking at them because of what they had been left like. Do you see why this is getting so important that I need to bring awareness back? Not just me, by the way, the other people who are genuine in the industry. Now, I believe that you get a gut feeling from people. See, if you look at someone and they're so smug and can do no wrong and is so wonderful, that's a red flag, right? I am 10 years doing this and things can still go wrong for me, but it's about, do you spot it? Do you know what you're looking for? Do you know how to bring the situation back to an area of safety? Do you know whether you should continue with the treatment after that? Do you know? You know, even the biggest Hollywood cosmetic providers, things can go wrong. So if you're seeing some blasé, always in the top of the game, just so good, that's a red flag. That's a confidence thing. See, when you're overconfident, that's when mistakes happen. My client was left today not only with the filler having been targeted, because the fat dissolver, yes, it will, minimise filler. Sometimes it will dissolve depending on the density of the filler that's been used. But other than that, it just tends to minimise it right the way down. And you don't actually realise that until you're re-injecting. You think, I can feel there's still wee granulomas there, or there's still something there. Now, my client had what I can only imagine a copious amount of fat dissolver administered to her oral region, right? Now, remember, we've got philtrum, the philtral columns, right, that are made up of a more, we'll just say a more dense tissue. You can feel it yourself, right? You can feel the difference between there and your philtrum, right? See, if you put fat dissolver in there, what happens is the tissue breaks down, and what happens is you're left with the empty poly bag syndrome, where there's just no substance in there, nothing, no natural collagen, elastin, fat, nothing, right? It's literally just a wrinkled piece of skin. If you use hyaluronidase in that area, it's going to target any dermal filler, which leaves the tissue pretty much as it should be. Do you see where I'm going with this? I hope people take this on board, because I was absolutely gutted. That's the best word I can use for the wee client that I seen today. As you'll see, I'm in the sieves because I had stuff on, and I just came over for this client because I realised that, it wasn't a nice way that she had been left. And if I can reinstill a bit of faith within the aesthetic field, then I'm trying. And like I say, others are too. I'll tell you what, that's actually been a big thing, see, because it is the 10-year anniversary for Revamp. that has actually been quite a prolific case that I have just begun with this client. When I say case, it's because it's not going to be a one-off treatment for this client. This client has been left in, when I say a state, I don't mean that badly, I mean state of repair sort of thing, where she is going to need a lot of work done caused by an injector. And that is sad. That is sad. I can only thank her very much for putting faith into me to take over a job that even I didn't realise how complex or severe it was going to be until I was in there. And I actually said to the client, I'm so sorry I'm going on about this, but I'm speechless. Anyone who is committing malpractice out there in the aesthetics industry, know this. You are the ones that are getting all of us legits a really bad rep because people think, oh no, we heard that, they'll be like that. And it's bang out of order. You are the ones that are getting our insurance premiums hiked up when you're not even paying insurance. Now take it on board. I am going to be telling clients, listen, see if you have had something elsewhere and you don't think it is what it is, ask for the proof, because if anyone else is doing the sort of job that I do, you should have the proof there. And see if I find out that anyone is administering anything that the client is not aware of, you better believe I'm going to advise that they go to trading standards, because it is wrong in all manner of levels, including morally. And I'm so sorry that this is going on in our industry, but it's time we're stepping up. We've got all the stuff going on in the background, even I still do. I will come back on with more, but for now I need to go because I've got places to be. Love H. One other thing that I'm going to do, and I'm going to put this out there, I'm going to put this out to Michael, I'm going to put this out to Gillian, Kerry, Tim. I'm going to tag yous. Could you please consider doing a post expressing from known medics how important it is to administer what you are telling the client they are getting, because in my area it seems to be getting more and more prolific, there's my word again, that people, for example, are being told that they are being dissolved with hyaluronidase and they are getting a completely different other product put in there, i.e. a fat dissolver. Now, your lipolytics are totally different, you know. Guys, I'm needing help here. I am doing the whole I stand with medics and aesthetics, the hashtag, you name it. Yes, I have been slacking in the awareness I've put out, but I'm really full on life at the moment. And do you know something? You guys that I've mentioned are the very ones that will hit the nail bang on the head to back up what I'm saying. You cannot ethically, legally, or morally administer a product to a client under the guise as something else. I can't believe that this is where we are at in this whole regulations and wanting some kind of control brought into the industry. Also, guys, it would really help me behind the scenes if you would maybe consider covering. You can have an NHS background. You are still classed as having a medic background, right? People are coming at me left, right and centre, giving it, if you're not HIS registered, Can you guys please, for me, explain that if you have worked within the NHS, within certain clinical roles, you are classed as a former medic if you have left the NHS and you are no longer under an active PIN. Now, I am finding that, again, it's your non-medics that are coming at me giving me, no, that's nonsense. It's not. If you are working within the NHS and you have a sideline of doing an aesthetics clinic, then you would be required to be HIS registered. If you are not working for the NHS anymore and you have been out of there for however long, you are not required to have HIS registration. And that there is a grey area within the hope of some sort of regulations being brought in, because I like what HIS does. Yeah, it's a nightmare. You jump through loops, and I mean, I've got, I say colleagues, more friends that are HIS registered because they are active within the NHS in clinical roles with an active PIN number. I myself, like I always say, am not HIS registered. I am not currently in what you would class as a clinical role, as in I am not currently working in any of the roles that I have held within the NHS in the past. I left to build what I have, and this is now my life. I could, under certain roles that I've had within the NHS, go back and practice, but I'm not, because this is my life. This is everything that I want in life. Now, it's time, get on, Michael, I know you will get exactly what I'm saying here. It's time that the medics and the former medics, we need to stand up, and it's ridiculous that you're having to actually put it out there as the medics and the former medics, because your non-medics are nitpicking about, oh, well, no, if you're not... Common sense is not that common, and it's pretty evident, to be quite honest. If you have held a clinical role and you have worked for the NHS or indeed the private sector and you're doing a clinical role, you are a former medic if you have left that position and went into aesthetics. That's just how it is. I don't know how much more patent I can make that, and that's why, guys, I've mentioned, you know, some of the people that I find quite relevant within the industry, and people that, you know, I look to for, you know, what are they covering, what are they looking at, what are they talking about, let's see, should I be looking into that as well. Realise they will see someone who is real and go, right, she knows, he knows, right, let's get in. And that's how our circles grow, and how we end up in likes of these umbrella terms of medics and non-medics, etc. And again, I'm going to say umbrella terms for anyone, apparently there's quite a few that don't understand what umbrella terms are. It means a group of things that are covered under an umbrella of one name. So you can have medics, and under here you can have surgeons, you can have physios, you can have dietitians, you can have podiatrists, you can have phlebotomists, you can have physio. Again, it boggles me that people can't fathom what umbrella terms are. I'm rambling, but like I say, I'd like to put this out with Michael, Tim, Gillian, Kerry, just do you know what, I'm going to tag you. Hopefully you see what I'm trying to put out there. Hopefully you'll maybe even view the other awareness things that I've done. Michael, I know you have, and that's very much appreciated. And I'll message you soon as well, because wow, I think you would just have a fit in a bad turn. Have a fit in a bad turn with what I heard and seen and helped with a client today. Wow. Obviously confidentiality there, but I can talk about the rough scenario. So guys, please help me out. I know you endeavour to get, you know, good practice out there, etc. But can you really please focus on how important it is to administer what you are stipulating you're administering and nothing else, especially when you are using something that is highly reactive, likes of hyaluronidase. People don't seem to understand exactly how severe an allergic reaction can be. It's like, allergy, take some Piriton, whatever. No, that's not what we are dealing with. Putting it right out there, you could be dealing with life and death. And the fact that there's people out there that think they can play with that disgusts me.